and lost teeth in the bottom, same deal. The teeth in front are gone, and the uppers are extra long. You can see they're actually longer than the rest. They're about 3/4 of an inch longer on the upper because there's nothing on the bottom to wear it down. Both sides, same thing. See? No opposing tooth, extra long tooth. So there's some of the pitfalls that can happen. And most people have a horse with that condition, and I swear they are completely unaware. I show them, they go, oh, I didn't know that was there. Like, okay, fair enough, no problem. But you know, I guess they put their bit in there, they're not really looking in the mouth, they're not inspecting it. I do this every day. So when I do look in a horse's mouth, I don't do this feeling of the points. To me, that's kind of a ridiculous thing to do. It's a good way to get your finger crushed. What I do is I have a light on my head, and I open the horse's mouth, and I look in, and I look at the occlusal surfaces, I look at the points, but I look at it so I can see what I'm doing. If I feel points, I felt a point. If there's a wave complex, I'm not going to feel that. I don't have to put my hand inside the horse's mouth and get it crushed. But they can have that big old wave complex or some big major problem in the back, so feeling points is not going to tell you anything. There could be a huge problem back here, you wouldn't even have a clue. So sometimes there's horses with no points, but they have other problems on their occlusal surfaces, and someone will go, yep, no points, teeth are good. Not really. You see, having no points is great, fine if they have no points. That doesn't mean they have no points here. It doesn't mean they don't have points back here. And you're not going to stick your hand on a horse not sedated back there. So that whole point thing, to me, is kind of ridiculous. I want to try to educate people that don't use that as a measure whether your horse needs dentistry or not. They really need to be just looked at properly, with a light, and investigate the teeth properly, and you can sit. Yes?
My regular vet, old regular vet, used to actually just come up. I'd ask if my horse's teeth needed to be floated. He'd look at how they matched up in the front and say, nope, they're okay.
Let me tell you the dynamic of veterinarians, and I work with a lot of veterinarians. I have a vet come out with me, because I have to have by law, if you're not a vet, you have to have a vet present with you. Even with just a hand rasp with no sedation, California law is such now that you have to have a vet there, or you're practicing veterinary medicine without a license. That's just the way it is. And a lot of people float horses' teeth without a vet there. I used to be one of those, but the laws are such that they really want to have a vet there. And I have to have my horses sedated anyway, so I even more so need a vet there than most people. So I have a vet on all my appointments. But in vet school, they're teaching you how to be a veterinarian. And my vet and I, ironically, were talking about this yesterday. She said, when I was in vet school, the first 3 years was a lot of classwork, and then we did working on animals, and she said, it was dogs and cats. She said, they barely worked on any large animals at all. They just mainly did dogs and cats, and you know, they went out with a float one time, and they floated some horses' teeth, a quick little rasp, but they don't take a lot of time to teach dentistry to vets. Everyone thinks that it's because they're a vet, that they're teaching them all about horse dentistry. Well, the vet school cannot dedicate 6 months to horse dentistry if the person is going to go out and be a small animal vet. Why waste the time? So at vet school, they teach them the basic anatomy and all that type of thing. It's up to the vet once they leave school to pursue dentistry. Because dentistry is more physical, and it's probably one of the harder things a vet will do, most vets tend to not want to do it. There are some vets that actually dentistry is the primary part of their practice. They're far and few between, but those people have taken the time, the instruments, and that's all they do. The guy I got taught by, Richard Miller, he's a veterinarian, that's all he does is strictly dentistry. He's 72 years old. He actually doesn't do the work so much himself. He has students that come from all around the world to train under him. And that's how he has students.
We have a vet in our area that specializes in dentistry, Dr. Kelly.
Oh yeah, I know him. He does good work. He's one of the few.
Yeah.
Dr. Kelly does good work, he does motorized tools, he does a fabulous job.
But then the guy I work for, I don't know if this is true, so you can disclose this, man. He had a Morgan that lived to be 30, and he claimed that by having a vet come out and do the teeth so thoroughly every single year that by the time the horse was 25, he didn't have any tooth left, and it was hard.
Well, the horse is going to run out of teeth anyway. Whether it's 25 or it's, it really varies, and I don't really, I guess it's what they're born with and the rate of eruption, there's a bunch of factors. But some horses at early 20s, the teeth are cupping, where they're running out of enamel and their teeth are at the end of their days. I have other horses that are in their 30s, and it's like they've still got viable tooth left, but they still have a good surface, there's lots of enamel, there's no cupping on the teeth at all. I just did a horse yesterday, actually, that was 28, and I was flabbergasted. I'm like, man, these teeth are in great shape for a 28-year-old horse, and it had not even had extensive dentistry in its life. When I did the horse yesterday, it hadn't had dentistry in 6 years. That's an exception to the rule. There's a paint mare, just one of those tough old horses that just, I think she's kind of horse you really couldn't hurt her. She was tough as nails. But that's the exception to the rule. Usually a 28-year-old horse is going to be a trained vet.
And so at that point, you aren't going to wear it down completely, you're just going to maintain like you were talking
it's
about.
Actually, that's really not true about wearing. Let me explain to you why. All you're taking away is the teeth that are taller than they need to be. The teeth that are the size they're supposed to be, you don't touch them. So if I have a tooth that's away, being here, okay, if I let that go, get taller and taller and taller, okay, eventually, speaking of teeth being worn before their time, these teeth are going to get completely destroyed. So by reducing the over long teeth, you're preserving the whole mouth. Now what you don't want to do is take all the teeth down, for example, to the shortest point. If I have these are called compromised molars. They mean they're worn past the normal length. If they're compromised, I shorten these to the normal length and wait for these to erupt back in to fill the void. Once I take the wave away on the opposing side, when I grind this tooth back, okay, and shorten it to the normal height it's supposed to be anyways, that allows this tooth to come back in again. So what you're doing is restoring the mouth. Now if you take all the teeth down to the lowest point, which you wouldn't do, Dr. Keller's not going to do that. He actually knows what he's doing. He's very well educated in this industry. So I know he would do proper work, as I do. But it's just, there are some people who don't offer this, so their defense, because they can't give you what, to like get your business, they'll be maybe less than truthful. Try to feed you into using them basic file plugging because that's all they offer. Or maybe they just don't know, maybe they're just plain ignorant. Just because you're educated doesn't mean that you're necessarily smart. You can be educated and still be ignorant in certain areas. And people say things that really have no basis to it. Now, on the flip side, there are some people who don't know what they're doing and they do poor quality work and they might grind too much tooth away. That's possible, but most of us in the industry who've been doing this long enough, we know better than to do the same thing.
We'll take it to your back.
Yes?
What if you just let the teeth go?
Then you have those horrible situations like I showed you. These are wave complexes. This happens because you don't do the teeth. The teeth should be all the same length like that. When the tooth gets extra long like that, it destroys the tooth on the opposing side, which makes it very hard for the horse to eat and increases the likelihood of colic and just makes the horse miserable in general. Yes?
Based on what you told us, can you recommend any type of hay over another?
I don't go too much into the hay side of it. I know for my own horses, I give them alfalfa hay and I give them a little orchard hay, and I use like Triple Crown Complete, like supplemental food on top of that. A lot of these four-way hays are kind of coarse. They've got wheat hay in there, I think, barley hay and a bunch of other. Those I'm not too keen on because there's a lot more work for them to break them down. Some people are down on alfalfa, they say it's too rich a food. I personally don't like feeding straight alfalfa. I'm from Australia myself. When I came here and I saw alfalfa being given a whole flake of, I was like, what in the heck are you doing? Back home we'd give it like a third alfalfa, 2/3 grass hay, just standard. And it's actually pre-chopped, it's called chaff. It's pre-chopped, it's in a big roll-out bag and we just scoop it out and it's easy for them to eat. And then we give other grains and supplements. But in California they're really big on giving straight alfalfa. Personally I think it's a little too rich. So I don't exclude alfalfa altogether unless a horse has a major problem. But some of the draft breeds are more alfalfa sensitive. They just do really well on a good quality grass hay. And some of the draft breeds will do better on that. But on most horses, me personally, I like alfalfa. And I don't like Bermuda grass, by the way. I think it's just nothing in it. And also with older horses, Bermuda grass is a really good way to get them impacted. Because if they can't chew their food well, they'll chew it. And it'll kind of like be long strand, but because it's such a thin hay, it's soft, and when it gets moist, they can swallow it without hurting their throat. They won't swallow if it's uncomfortable to swallow. For example, alfalfa is stemmy. They'll spit out balls of alfalfa if they can't chew it well, because that thick stem will hurt to swallow. Bermuda hay is not so stemmy, it's a very fine hay, therefore they can chew it, soften it, and swallow it, and there'll be long strands. Those long strands can ball up and cause an impaction. Dr. Williams in Norco, he's the one who kind of enlightened me to that. I kind of had a hunch about that myself, and he told me he opened up a lot of old horses who were given Bermuda grass hay, and they were all balled up, they couldn't chew, the teeth were completely shot, and that's what caused the impaction. So I kind of steer away from that. Yes?
What would you do if a horse that broken its jaw is younger and not?
Well, if it broke its jaw when it's younger, it most likely fractured it, where it didn't actually snap the whole thing, otherwise it had a jaw hanging off to the side, and it probably wouldn't even be able to eat. If it's fractured and healed up, generally it should be okay. I've had horses